Our Vista vaccine line is one of the products that we're very excited about, and some recent research has been completed, has been our duration of immunity studies. Those studies, we took calves that were about 3 months of age, vaccinated them one time with Vista 5, and then waited a full 365 days before we came back with a challenge. And so we did 3 different challenges: IBR, BVD1, and BVD2. And what we saw basically was just tremendous protection, even a full year away from vaccination, which means that we had a tremendous initial response to that vaccine in order to create the memory cells then that provide that protection that far out. For producers that use Vista once, that combine our 5-way viral with our Pasteurella and Mannheimia bacterial protection, we've also done duration of immunity studies for the bacteria. Those were done at 16 weeks, and again saw a significant reduction in the amount of lung lesions in the vaccinated calves versus the challenge. The reason 16 weeks is important is because it's the first duration studies that have been done with any kind of Pasteurella vaccine, so we're proud of that work. And Vista once contains 2 antigens, the Mannheimia hemolytica and the Pasteurella multocida. There's been some debate about how important is Pasteurella multocida. We don't see it as much in diagnostic lab reports, and that's changing over the years. It's interesting that when we look at samples that are sent in after an animal has died, Mannheimia usually predominates, but Pasteurella is always there in the mix. But if we take nasal swabs of calves as they're getting sick, we see just as much, if not more, Pasteurella as we do Mannheimia. And so we feel it's very important that we have a vaccine to provide some protection against both of those strains of bacterial pneumonia.